Good morning, everyone. So my study was to find out the relationship between IL-6 and IL-10 and its correlation with vitamin D in posterior segment diseases of the eye. So as we know that there's a substantial burden of posterior segment diseases leading to low vision all over the world. Current treatment regimens of such diseases entail the use of costly anti-VEGF intravitreal injections given several times to achieve an acceptable decrease in disease activity. Use of laser photocoagulation has its own set of side effects apart from availability, which limits its use. Leaving behind a lacuna in the treatment of the disease management to be filled by other potential therapies. So the present study investigates the legends surrounding vitamin D and its multimodal effects in the eye, specifically the posterior segment diseases. So few studies have shown the anti-inflammatory effect of vitamin D on the body attributed to its steroidal mechanism of action, and have thus suggested a potential therapeutic role in diseases which involve inflammatory pathways. And several studies have highlighted the inflammatory processes in play in a majority of these posterior segment diseases, especially diabetic retinopathy, age-related macular degeneration, retinal venous occlusions, and uveitis. So this was a case-controlled study conducted on 93 patients presenting to our OPD, and institutional ethical committee clearance was obtained. Patients were segregated into Group A, comprising of 60 patients, which had posterior segment diseases, and Group B, 33 patients comprising of age and gender matched healthy controls. The exclusion criteria was any systemic inflammatory disease, any autoimmune disease, history of retinal laser photocoagulation, any intraocular surgery, use of steroids, any oral vitamin D supplementation in the past 3 months. A detailed history and examination was done. Fasting blood samples were collected in K3 EDTA tubes, and plasma was separated by centrifugation. IL-6, 10, and vitamin D estimation was done using ELISA kits. Statistical analysis was done using SPSS21, and p-value of less than 0.05 was taken as significant. So out of the 60 patients in our study group A, patients with diabetic retinopathy formed the majority of the patients, followed by retinal venous occlusion patients, ARMD, uveitis, and Eales disease. So we found that plasma vitamin D concentration was found to be significantly lower in diseased participants as compared to healthy controls. And this turned out to be statistically significant also. Similarly, plasma IL-6 concentration was found to be significantly higher in the diseased participants as compared to healthy controls. It was also observed that we took out a correlation, but it was statistically insignificant. Serum IL-10 was also statistically higher, and its correlation came out to be statistically significant. So in conclusion, our study showed a higher level of plasma IL-6, IL-10 in the posterior segment diseases, indicating a possible inflammatory mechanism in the pathogenesis of these diseases. Vitamin D is known to have an anti-inflammatory effect among various other effects in the body. The negative correlation between vitamin D, IL-6, and IL-10 may be used as a possible target in therapeutic regimens as a measure to decrease the financial burden on the patient by possibly decreasing the number of anti-VEGF injections. That's all. Thank you.
So whether there was any gender differences in vitamin D levels, or have you seen?
So we did not. It is something that the data is there. It is something that to be analyzed. But in general, we saw that the overall population was a little on the lower side of the vitamin D levels, but the diseased population was significantly lower. Like they were almost like 10-15 points lower.
No, I'm asking about the male to female ratios.
Yeah, so that is the data is there. That is left to be analyzed.
Okay.
When exactly did you do this study?
Ma'am, it was done during my MS time from 2018 to 2021.
Yeah, the reason I'm asking is that a lot of patients during COVID times had a lot of these inflammatory biomarkers and
Yes,
D3 going haywire, and they persisted much later after the COVID
so ma'am, this was one thing that so a lot of papers were coming out regarding the role of vitamin D. So what we did, and we were a little free at that time because academic activities were all stopped. So we called some of our patients, and we got to know that inflammatory markers, vitamin D levels were kind of relating to the morbidity and mortality. So It's just a random fact, but none of our patients lost their lives which we contacted. So that was one thing. And all the patients, so we had also supplemented vitamin D later to find out the effect, and that is again data that needs to be
analyzed. Yes.
analyzed.
But so you did not ask any of these patients whether they had a history of COVID infection in their past,
ma'am,
clinical or subclinical.
So COVID infection was our sample collection was completed by almost like 2019, and it was.
That's what I asked you. When was this the sample thing? Before pre-COVID?
It was pre-COVID, ma'am. Okay. Thank you.
Thank you.